The first thing this new regulation asks us to do is to make sure we're providing trauma-informed care to trauma survivors. Well, how are you supposed to know who that is? In fact, we have a lot of ways to find out who that is as part of our comprehensive, person-centered assessment process. And that's not new to us in skilled nursing. We've been doing that for years and years. Assessment happens in many formats. And so, because there's no requirement or guidance on how to screen for trauma, I want you to think about all the assessments we already complete and how you might determine that someone has a history of trauma from the tools we already use. For example, facilities use a multi-pronged approach to identifying a resident's history, right? We look at the history and physical. We might talk to the resident. We do a psychosocial assessment. We might get a lot of information from the hospital inquiry and hospital paperwork. We have our resident assessment instrument, the RAI, also known as the MDS. And we have interdisciplinary admission assessments and interviews, including from the activities department, social service department, nursing department. And we also have our own eyes and ears. We have our powers of observation. And that's what I really want you to use to try to identify a history of trauma. If you consider that you're already assessing for history, and you already have some medical records, and you do an interview, there are going to be indicators if you know what to look for. And to me, that is the essence of assessing for who is a trauma survivor. We want to focus on indicators rather than formal assessment tools, which are often designed as screens for PTSD. And we're going to talk about that later too. Indicators, so behavior symptoms, cut across cultures and languages where screening tools do not. Sleep disturbance, anxiety, refusing care, smoking, drug and alcohol abuse are huge indicators of a traumatic past. These behaviors should be viewed through the lens of trauma-informed care to better understand their root cause. Again, focus on indicators rather than diagnosis. That is trauma-informed care. It's information that goes into your assessment, and your assessment drives the care plan, and your care plan tells you what to do to help this person. So I find this to be very effective in fitting trauma-informed care into what we already know and already do.